Good afternoon, everyone. Wynn Brown here with Heywood Healthcare's weekly recap for Friday, September 4th, as we head into the long weekend. I hope everybody who is not working over the course of this weekend gets to enjoy some extended time with their family as we celebrate the end of summer and we slide into fall, and it's a beautiful weekend, so let's enjoy it and get outside. I'm going to jump right into testing where we usually start. Our cumulative positive rate is 3.1% versus the state at 4.7%, and our 7-day rolling average is at 0.43%, so less than 0.5% positive versus the state at 0.9%. So you can see the state has actually improved overall and coming in alignment to where we have been historically. We've done over 18,000 tests so far, and 17,242 of those are negative, 553 total positives. And that's where we get our rates at 3.1% cumulative. So great work by our community. I appreciate all the hard work that everybody's doing. I know a lot of you are also taking advantage of our on-site testing, drive-through testing on the Heywood campus, and that is available to anyone who wants to be tested, whether or not they have signs and symptoms, where they really should go to urgent care first, or perhaps they're traveling or need to get back to school. We are actually one of the few community hospitals in the Commonwealth that are providing this level of access to testing 7 days a week. So if that's something you need, we are available to you, and you can call and make an appointment either next day or later in the week and get your slot, because they do fill up quickly. And so thank you very much to our staff at the Heywood Medical Group who's been doing that testing for us. I have a number of announcements for staff, just to update you on a number of things. First, you got an email earlier this week from Paul Heffernan, our VP of HR, about the new Massachusetts Paid Family Medical Leave Employee Act, which requires that all staff, employees in the Commonwealth, qualify for paid medical leave. And there's a new tax that is coming into action, I guess I would say, on October 1st. And so we are required to give notice to all staff about that. I need you all to log into HealthStream, and there's just a 1 or 2 questions there that you just have to click on to acknowledge that, so that we are in compliance. So I encourage everybody to do that before September 30th, okay? And just an employee health update. Earlier this week, we put out an email updating our travel policy. And so that is on the intranet, and if you have any questions, you can contact Employee Health directly, and the email is embedded in with this video for you to click onto. And then we're following up on the child care survey that we did. Don Cassavan is leading that project for us. So stay tuned. We're looking at options of how we can be supportive, and we'll probably be reaching out again to get some more specifics as we try to see how we can support everyone who's challenged by childcare issues with the changing in the school schedules going on. So please know that we're trying to figure out how we can work on this, and so patience, but we also are trying to work quickly to see what we might be able to do. Also for frontline staff, Cambridge College, which is part of New England College of Business, is offering special scholarships for frontline workers, and there's a link for that if you want to take a look at that. And we also have been catching up on our service stars, and so we have 2 service stars that we recognized last week. One is Myrna Thompson, who is just fantastic and joined us a couple of years ago after working for Dr. Taylor for a number of years. And her colleagues say Myra's dedication to this office is only surpassed by her compassion for our patients. Myra goes above and beyond and makes sure that every patient's encounter here goes smoothly and efficiently. She is wonderful to work with, always offers her help freely, and gives of her immense knowledge. She is an incredible asset to our team. So thank you very much, Myra. In specialty care, and then Deb Gukowski from the Spine and Pain Center. When I think of someone who exemplifies our care values and has really embraced heart long before we had heart, it's Deb. She has, and is, in my opinion, one of the most difficult jobs in our organization. She mans the front desk for Dr. Kalava. Just given the sheer volume of patients that she interacts with each day, both face-to-face and over the telephone, she creates countless interactions with our patients. Not to mention, these are patients who live with chronic pain and come to us at their worst in many cases. She treats everyone with the utmost compassion, respect, and kindness. So congratulations to our 2 service stars this past week as we continue to catch up from our COVID time where we took a little time off from it. And so fantastic recognition for some incredible staff in our midst. Some special announcements, flu vaccines, probably a lot of you have already seen the CDC announcement, but really recommending early vaccination for flu vaccine. We will be getting ours out as soon as we have them available. And again, we're going to be requiring staff to have those as well. But really the community who's watching this needs to get those flu vaccines, whether it's from us or from your local CVS. Or a flu vaccine drive somewhere. Please, everybody get it early so that, as we are concerned about a surge of COVID-19, remember a lot of the symptoms of flu are similar to that to COVID, and it really could be a complicated situation if we're not on top of it as a community. And we've done a great job as a community really being proactive in our preventive measures. So please take that to heart and make sure you get scheduled to do that as soon as it's available in our region or through your provider. Also, we have a number of vacancies available in housekeeping and environmental services. In particular, we have raised our minimum wage across the board and the whole system to $15 an hour along with benefits. So if you know someone who's interested in coming to work at Heywood, please have them go right to heywood.org/careers and take a look at our openings so that we can make sure that we're fully staffed to meet our patients' needs. And we will work very quickly to bring them through the process. In the background running, as you know, we've been operating our Watkins Faust golf tournament, which is one of our biggest fundraisers, virtually every week. So we have a group of 4 to 5 foursomes come out. I meet them every morning when they tee off and try to catch them when they're back after they play. So our most recent sponsors are Alliance Health at Baldwinville, Hospital Medicine Solutions, who are our new hospice group who begin October 1st. Gardner Redevelopment Authority, Montechusett Veterans Outreach Center. So they played this past week and had a fantastic time. And so appreciate everything everybody's doing. Remember, we still have our Yeti raffle, which is fantastic, and you can purchase tickets for that. We are at over $1,500, I believe, in raffle tickets so far, and there's a link right here for you to log on to that. And then Lifepath in our region is offering free online healthy living workshops, which provide information and practical skills to help participants assume an active role in managing one or more chronic conditions. So if you have a chronic condition or one or more of those, or you know someone who does, you can click the link here and learn more about that. And send an email right to Lifepath and get involved in that. And then finally, in a recreating of our events, we are at the last part of our Ride for Your Life, which ends on Tuesday. We have a fantastic weekend weather ahead of us, so if you want to get involved in the ride, you can click on the link and be a part of that. And a shout out to one of our participants, Allie Borges and her family, and the family, Dean and Elaine Draper from Fitzwilliam, New Hampshire, and their unique participation in the ride. So we appreciate everybody's support. Thank you for all you're doing as we continue our journey to be one of the best community-owned health systems in America. And I hope you have a fantastic long weekend. And everybody take care of yourselves. Have a good one.